O'Hara. I'm a student nurse and I'm going to be demonstrating how to administer PCA morphine. I'm going to quickly perform hand hygiene and begin. So the first thing we're going to look at is we're going to look at the physician's order sheet. We're going to see our patient, Marcy Paris, FIN number 123456789, 55 years old, no known drug allergies. She's been ordered a PCA dose of morphine 1 milligram per milliliter with a lockout interval of 5 minutes. The physician has signed and someone else has signed. So this is good. I can move on to comparing this sheet with the patient MAR. The patient MAR is right here. So looking at the patient MAR, I've got Paris Marcy, FIN 123456789, FIN 123456789, 55 years old, Dr. Amanda Jackson. So I'm looking at the date. It's 21 days and the time is now. The PCA dose is 1 milligram of morphine, 1 milligram of morphine at 1 milligram per milliliter with a lockout time of 5 minutes. And I see that there are 2 signatures. So I feel good about this. I feel good about this MAR. So I can put the doctor's orders away now. And next I will compare the, Next I will compare the MAR to the parenteral drug monograph. So I'm looking at the drug. It's morphine sulfate, and I recognize that this is a high alert medication. So a high alert medication means I'm going to need a second nurse to sign. I can administer this medication as a student nurse. I can give it PCA, and I will refer to further for the recipe for that. I recognize that this medication is compatible with D5W and normal saline, which is good because I will be mixing it with normal saline. I recognize the hazards of this medication as an opioid, respiratory depression, shortness of breath, and all the rest. I will monitor my patient for these and also kind of go through what to look for with them. And I'll be using this medication to help relieve the patient's post-surgical pain. I'll be monitoring vital signs such as blood pressure and respiratory rates, etc. I will also have Narcan on hand in case of opioid toxicity and needing to reverse the effects of the morphine. Finally, I'm also going to look at the PCA rate and dose calculations. So I'm going to be making this first recipe. I'm going to be drawing up 50 milligrams or 5 milliliters of morphine in ampules. The ampules are right here, and each of the ampules should say 10 milligrams per milliliter, as it says here, 10 milligrams per milliliter. I will add the 5 milliliters to a volume of 45 milliliters. So I'm going to need to take out 5 out of that for a final volume of 50 milliliters with a final concentration of 1 milligram per milliliter. So I understand what I'm going to be making, and I can do my first check. So my first check is with the patient name, Marcy Paris, FIN 123456789, 55 years old, with Dr. Amanda Jackson. That's the right patient. The right drug is morphine. I've got morphine, and I've got here morphine. The expiration date is good, 10 milligrams per milliliter. Morphine, 10 milligrams per milliliter, good expiration date. Morphine, 10 milligrams per milliliter, the expiration date is good. Morphine, 10 milligrams per milliliter, good expiration date. And finally, morphine, 10 milligrams per milliliter with a good expiration date. So I feel confident with all my medication right here. My right dose, I'm going to be giving a dose of 1 milligram per milliliter or per push of the button. I will be putting 50 milligrams into 45 milliliters for a volume of 50 mil, giving a final concentration of 1 milligram per milliliter. They will be getting that dose. That's the right dose. The right route is IV, PCA IV. I know that this is compatible based on what I've read from the parenteral drug monograph, and I know it's going to be an IV medication here because it is on the PCA MAR, and the right time is now. So I feel confident with this. So I'm going to start to draw up my medication. The first thing that I'm going to do is I'm actually going to withdraw the normal saline, 5 milliliters of the normal saline with a blood fill. So I'm going to do this. Do it one more time because I've got a nice big bubble. Okay, good. So, and I'm going to make a label for that. I'm going to put this right here. And S 5 ml. Just because they're both clear fluids, I don't want to mess that up. So that's 5 milliliters of normal saline withdrawn from 50. So this has now got 45 in it. So the next thing I'm going to do is I'm going to start to draw up my medication. I've already opened the ampules. I'm not going to use them right now because of technical difficulties, but usually with an ampule I'd be using a filtered blend fill with like a little purple tip. As it slowed me down in my last demo video, I'll just be using a regular blend fill to draw up 5 milliliters from all these ampules. Okay, so I'm going to quickly push the bubbles out, and I see I've got a little bit more than 5, so over the sink what I would do is I would get rid of this and waste it until there is 5. So I've now got 5, and I'll quickly label this syringe. Danielle, somebody? I've got a, thank you. So, come on. There we go. So here is the morphine. I am now ready for my second check. With my second check, I will grab my second nurse after this check so she can sign the signature. I'll be doing my second check with the MAR, with the parenteral drug monograph, with the label that I have made with my medication that I've drawn, and with my medication right here. So the first thing I'm looking at is the patient name, Marcy Paris, 1, 2, 3, 4, 5, 6, 7, 8, 9, 55 years old, for Dr. Amanda Jackson. That's the right patient. The right medication is morphine. I've got morphine on my parenteral drug monograph with 10 milligrams per milliliter. Morphine, 10 milligrams per milliliter. Morphine, 10 milligrams per milliliter. 10 milligrams per milliliter morphine. Morphine, 10 milligrams per milliliter. Morphine, 10 milligrams per milliliter. And I've got the morphine right here. I've got 5 milliliters for 50 milligrams. So that looks good to me here. Hi, I've got another pump issue. Thanks. Sorry. So the right drug is finished. Now I'm looking at the right dose. My dose is going to be 1 milligram. Once I add the 5 milliliters to 50 milliliters, it's going to be 50 milligrams per 50 milliliters, which means the dose is going to be 1 milligram per milliliter, and that's correct based off the parenteral drug monograph, the MAR, and the medications. That also matches what I've written on my label right here. It is a medication that's prepared for IV based off the parenteral drug monograph and the MAR, and I will be giving it via Curlin pump with this mini bag, and the time is now. So now I would grab my second nurse to sign off on my medication. I get her to sign this right here. If you want to sign, yeah, excellent, signature in. So at this point, I can put these in med waste. I put this away in the sharps container, and I can inject the morphine into my mini bag. So I would quickly grab. You know what? One of the things I actually realized is I'm not sure if I sanitized this before taking out the normal saline at first. So one of the things that I would have done is I would have cleaned for 30 seconds my mini bag and let dry for 30 seconds sterilely before drawing the 5 milliliters of normal saline. So I'd put this in and ensure all of it is injected. Move this and close this. Now I'd give this a nice shake so the medication is mixed up, and I would add my label. You'll notice the label has a bolus of 1 milligram. It's not a continuous, and it's got a lockout of 5 minutes. When I go into the room, the pump will reflect that. So going into the room, disposing all of these in sharps containers, all of the needles in sharps containers. I'm going to take the MAR, I'm going to take
might shut off your pump, just so you know, ignore it and pretend it's running TKV.
Thank you. I've got the alcohol swabs, I've got my medication, the tubing is already in the room, and I've got, for my tubing, a label. I'm going to perform hand hygiene as I go into the patient's room. So, knocking on the patient's door. Thank you. Hi, my name is Leah O'Hara. I will be your nurse today. I'm going to quickly check who she is. Can you please tell me your first and last name? Marcy Paris. Marcy Paris. Fantastic. And how old are you? 55 years old. Excellent. And I'm checking the fin. 1, 2, 3, 4, 5, 6, 7, 8, 9. I know this is the right patient that I'm looking for. So Marcy, today I'm going to be changing your medication. You are using a PCA pump right now, or a patient-controlled analgesic for morphine. This is to control your post-operative pain. Are you familiar with this? Marcy, the patient says that she's familiar with this. So I just wanted to tell you that it might cause signs or side effects such as respiratory depression, nausea, fatigue. It might cause a few different things, and so I'm going to be monitoring her closely. I'm going to make sure she understands what she should be looking for and what she should tell me. If she feels weird at all, she can call me. And yeah, then I'm asking the patient if she is okay with me giving her the medication, and she is. So I'll also make sure that I'm going to check her vital signs before with a particularly paying attention to blood pressure. At this point, one of the things I'm going to do is I'm going to assess her IV side, ensuring everything is open. I'm going to look at what's running. So she's already got normal saline running. I see that the normal saline is running TKVO on this pump, so it's going nicely. All of her pumps are open, and this is what the PCA is with the Curlin pump. The bag is pretty much empty, so I do have to change it now. She doesn't report any tenderness and don't see any swelling or edema, so her IV side is good. I don't have to flush anything because she is running a TKVO. So at this point, I can do my final check. So I've got the right patient, Marcy Paris. She's identified herself. The right drug, I've got morphine 1 milligram per milliliter. I've got morphine 1 milligram per milliliter. It's a bolus of 1 milligram. That's the right drug, also the right dose. The right route is IV. I've got the IV pump here for the PCA, and the right time is now. So I'm ready to set this up at this point. Okay. One of the things I could do maybe is I could also set the pump first. I might do that. I might as well. So I'm going to turn on the pump. And smart. Okay. It's just turning itself on. While it's happening, I'm just going to look at the back for the code. 69. Okay, so yes. The code is 4629. Okay, so now we're going to start to input what we're doing. So the units are in milligrams. I'll be giving 1 milligram per milliliter. The concentration. The final concentration is going to be 1 milligram per milliliter. The route is IV, we know this. There is no loading dose. And there are no med limits right now, so we're going to continue. The bag volume is 50 milliliters. We're not setting up a basal rate, but we are setting up a patient bolus. We want them to get 1 milligram when they press the button. And the lockout, so the time that the patient will have to wait between requests for boluses, is 5 minutes. She's going to get 12 boluses per hour. That's 60 divided by 5. And we're done. Okay, so at this point we can just change the bag and set it up. Excellent. Can I hand this to you? You can just throw that out. That's an empty bag. Okay, so maintaining the sterility of both of these. I'm going to spike the bag. Okay, excellent. And I'm going to make sure this is good. So at this point, it's already hooked up to the patient. I haven't pressed start yet. I would get my second nurse to come in, and I would get my second nurse to review all of this to make sure I have set it up correctly.
Looks good.
The second nurse has agreed that it looks good. So at this point, I can I can close and lock this, and I can press run to start. It will only infuse if my patient presses the bolus. I'm double checking that all my clamps are unlocked. The normal saline clamp is unlocked. This clamp is unlocked, so there's nothing in the way. I'm going to put this line on this line. This line says morphine, it says the date, and it says the time. And that's an identifier, just so they know what's running. I'll tell the patient to call me if they're experiencing any strange side effects or symptoms. I'd make sure to check up on their vital signs. I will sign the MAR with the date and the time as well. I'll get my second nurse to sign the MAR with me. And I would do a final safety check before I left the room. But other than that, I am all finished. So that was the demonstration of PCA morphine.